what is hepatitis? Hepatitis is inflammation of the liver which can cause liver damage. How does it occur? It occurs mainly from alcohol, drugs, genetic factors, fatty liver, infections with bacteria and viruses. Particular viruses that cause hepatitis are viral hepatitis A to E. So today we are focusing mainly on viral hepatitis with these 5 viruses. So what are the symptoms? The symptoms depends on whether the infection is acute, that is a short-term infection, or chronic, that is a long-term infection. If it is acute, there may not be symptoms or there may be only mild symptoms, or rarely there can be lethal severe complications and can there be death also. But symptoms, if it appears, they include fever, fatigue, nausea, vomiting, loss of appetite, dark urine, pale stools, jaundice, that is yellowish discoloration of eye whites and skin, joint pains, etc. While in chronic hepatitis, it is usually asymptomatic or it may appear only with symptoms like fatigue. But even though it is asymptomatic, there is a progressive underlying liver damage, and over decades this can remain silent, and at the end, when the warning signs appear, the liver may be irreversibly damaged, as in cirrhosis or liver cancer. So how does it spread? It can spread mainly by 2 ways. One is the hepatitis A and E, which is called the foodborne or the waterborne illnesses. They spread usually by poor hygienic practices, poor sanitary conditions like that. While there is hepatitis B, C and D, which are known as the blood-borne infections. These spread by the contact of blood and body fluids, as in the transmission from mother to child during the birth process, with unsafe sex practices, unsafe injection practices, unsafe blood transfusion, as in getting or not getting the blood from a properly registered blood bank. These are the methods in which these infections spread. Okay. Suppose someone gets the infection. What are the treatments? Are they curable? Okay. So many of the patients who get the hepatitis may not require treatment, but they require to be closely monitored. Okay. And there are medicines available for hepatitis C and hepatitis B. If you ask whether they are curable, hepatitis A and C are curable. Hepatitis E goes away on its own. While hepatitis B and D, they are not curable, but they can be kept under control, so they do not focus on to cirrhosis and liver cancer. But they are preventable. Hepatitis B, D are preventable. So what are the preventive options? The preventive options are, one is vaccines. There are safe and effective vaccines available for hepatitis A and B. And the vaccine available for hepatitis B is also effective against hepatitis B. So we can prevent hepatitis A, hepatitis B and hepatitis B with proper vaccinations. While hepatitis C, there is no vaccine available, still it is curable. There is treatment available and we can eliminate hepatitis C from the body. That is around 350 million people are living with hepatitis. And every 30 seconds there is a death happening due to hepatitis. And 95% of these deaths are due to hepatitis B or C. Together we can bring down the disease, ensure the vaccinations, get yourself tested, and if needed, get treated at the earliest. If you require any consultations, I am available in Badr Al Samaa Hospital, Barka, in all weekdays except Friday from 9 to 1 to 9. Thank you.